All right. Good evening, everyone. Thank you so much for joining in. We have very interesting people today who are on a mission to disrupt healthcare industry by using cutting edge technology. And it's definitely my honor to share the virtual stage with both of them. And we at Z.Talks bring the community leaders and entrepreneurs, business leaders across various parts of the globe to discuss their journey and also insights about various emerging technology. So my name is Aman Sanduja. I am the co-founder with Zubi. Zubi is on a mission to equip and enable students on emerging technologies, and we are targeting that we would enable 1 million students by end of next 3 years. So India is definitely a country of population with 1.35 billion, and it's growing so fast. So is the cancer patients, if you look at it. And I was reading a couple of days back, we have about 1.15 million cancer patients in India. And 1 out of 15 patients die or suffer from cancer in their life. So we have Rashie Jain, who is a woman leader and a co-founder of Onco, a platform which connects oncologists with patients. And she's an alumnus of premier IIT Kanpur and Wharton Business School. And also we have the co-founder of Navya Life Care, Mr. Gaurav Gupta, an alumnus of ISB, the company who is trying to build Siri for doctors, if I'm not wrong, or they've already built it. So they are building a patient-centric solution which you can access on the go. So over to you, Rashie. Why don't you tell us about your journey and your introduction to artificial intelligence and how you have started your business in oncology?
Sure, Aman. Thanks for the introduction. Let me begin by talking a little bit about why we started Onco. So, essentially, what we realized was that every cancer patient and their family they face a massive information gap when they get diagnosed with cancer. Right? It suddenly happens, and you don't know where to go, what is the right treatment for you, what outcomes can you expect, and in this massive chaos in their lives they essentially are pretty powerless in terms of determining the next steps. And this is something that I personally experienced in my life as well. My father-in-law had cancer, and as a family we struggled, and I had seen the entire oncology sort of ecosystem through my work experience before Wharton, and sort of realized one important thing, that you can actually build a technology enabled solution. You can actually build a platform that is patient first, that is out there to empower the patients with the right information on their treatment. And that was sort of this inspiration to decentralize information in oncology led us to build onco.com. Me and my co-founder, Dr. Amit, we started this journey 4 years ago. And today, onco.com is essentially a digital platform for cancer patients and their families where they can get personalized treatment advice from a network of top oncologists in India and US. We also have developed technology platforms that allow us to offer automated opinions and navigational guidance to cancer patients to get started with their treatment. On top of that, we offer personalized recommendations on the right doctors, on the right hospitals, diagnostics labs. So we've built an entire ecosystem of service partners. And we basically allow the patients to first centrally get all the advice they need and then manage their care end to end. And we feel this has allowed majority of our patients to get on corrective treatments, to get the best optimal outcomes, and hopefully feel more confident as they get on their treatment journey. Today, Onco is a fairly big team. We are a team of 120 people, and we serve patients not just from India but from many emerging markets, 18 countries in total. And it's been a fascinating journey building this company.
I'll come back to you on how virtual assistant can add another layer on top of oncology. Gaurav, how has been your journey from being a management consultant to starting something for Siri for doctors? That's literally interesting. Why don't you tell us more about that?
Yeah, hi Aman. Thank you for inviting me and very interesting work you're doing at Zubi. Congratulations on that. Uh, so, uh, just quickly, we didn't really start where we are right now. So, as an entrepreneur, we did a couple of pivots. to, and now we're doing what we're doing. So so basically, the story starts from the place where we as patients felt a lot of issues with respect to the engagement that happened between doctor and a patient. So when you come back from a doctor's clinic, you don't know how do you do. I mean, what to follow now. And if you have completed your treatment per se, partially you don't know how to, what to eat, the diet related issues and the follow-up related issues, the medicine reminders related issues were there. So we started as an engagement platform. Eventually, what we realized was doctors essentially in the ecosystem are not uh, very technology savvy and are not willing to put in information on technology because they don't have enough time. In India, doctor patient ratio is really skewed towards lack of doctors, and we have about 1 to 1700 doctor to patient ratio in India. So there, expecting a doctor to use technology where they had to type and create records was very difficult. So we realized that we need something which is smarter, where doctor doesn't have to use a computer, a dashboard, a keyboard at all. So we built a system where they can speak, and essentially the records can be generated for the patient, leading to a lot of downstream effects that can come in with respect to patient care and patient outcomes.
That's really amazing because I personally have faced a lot of problems understanding the handwriting of a doctor. So if they can create my patient records using a voice and I can comprehend on that, of course, you definitely would be catering to the different vernacular languages which we have in India. I'll come back to you on that. So, Rashie, if we look at from creating new drugs to new diagnostics, artificial intelligence is definitely playing a fundamental role, and we are looking at the fundamental shift which has happened. And AI is definitely transforming the biology, healthcare, and now applied to each and every vertical we look at it. And in this pandemic, we have seen how telemedicine have grown over past 3 weeks, if I'm not wrong, in India. So, how do you see and where do you see that how AI is disrupting in healthcare industry, and what are the challenges, and what could be the emerging application we could see it in the future? And
Mhm.
possibly after 6 months, 1 year, or when I will be having my children or grandchildren, do they still need to visit a doctor? I personally love visiting doctor because the feel I get it, he puts it a stethoscope and then thermometer, then checks after having a conversation. But do you see that artificial intelligence will definitely shift this doctor human interaction which we are seeing at this point in time?
Yes and no, Aman. So let me break this question down. So I think to begin with, I want to, set the context that healthcare is complex. Healthcare is a massively complex field, and depends on the kind of disease the patient has, depends on the kind of healthcare system the country has. A lot of processes can be automated through AI tools. And let me tell you what I think where we have done phenomenally well as an industry. Where have we seen adoption of AI happen aggressively in the last 10 years in healthcare? I think that has to be mostly in the field of image processing in radiology specifically. So what we had seen was that many years ago, 10, 20 years ago, radiologists used to physically view CT scans, MRI scans, and based on that identify manually, based on the observations that they made manually, diagnose and write down their observations. Now, I think what we have seen happen in the last 10 years is that we have made significant progress in terms of building AI algorithms in image processing that can identify and diagnose and read CT scans with more precision and accuracy than radiologists. So, if you talk about radiology as a field, I'm pretty sure that we'll see a lot of disruption happen in the way uh, scans are read through technology in years to come. Now, if you take a slightly more macro view and say, can AI and technology replace a doctor completely in the next few years or next 10 years? I don't think so, because I think one thing which is a limiting thing for any AI algorithm is that you need to have a very comprehensive training data set, and then you're, of course, bound by um, specific rules And we haven't made enough progress in the field of technology, AI, and specifically in AI, that can allow us to um, be precise and accurate in all the scenarios, medical scenarios that a doctor is presented with. So I see the role of AI emerging as an assistant to the physician community, to the patient community, as an enabler. Technology is going to be an enabler in healthcare, and it is going to address the existing gaps that exist for stakeholders in healthcare. But I think we are at least a few decades away from actually completely disrupting healthcare, where automation will drive everything. I don't know if that answers your question.
No, it does. So, do you see that adoption is definitely gonna happen, but with the kind of education material or the kind of scope of learning we have it in India, it's very limited because the subject matter expertise of a doctors is from the perspective of medicine study they do. But now the health tech companies are being started by entrepreneurs like you and I or Gaurav, who do not really have much of an experience. Of course, like you have a person in your team who has studied medicine or healthcare. So, do you see that is it because of the lack of learning material or the courses which are available for people to adopt artificial intelligence or emerging technology with the specific problems they are facing in the country like India?
Not necessarily. I don't think so. I think we live in a time where we are all very connected, and for any student or individual who wants to understand about what's going on, what's the cutting edge development in the field of AI, all they need to do is subscribe to a ton of online courses. There's a ton of information available um, to anyone almost today to educate themselves, to build a product in this domain. I think specifically for our case, let me tell you, I do not think that you know to create tech products in a domain like oncology, subject matter expertise is not required. At Onco, we have a team of you know 12 oncologists who work very closely with our tech team to build all the protocols, all the products that we have launched, all the virtual assistants we have launched. So I see of products getting launched in healthcare to be developed by a combination of skill sets of doctors who are subject matter experts in the field, researchers who have an understanding of the domain, as well as engineers and data scientists who understand the algorithm and the technology aspect of it. And a combination of skill sets can result in creation of some cutting edge products in healthcare. But I'll be curious to hear, I guess, Gaurav's view here.
I was about to go to Gaurav on this point because I see that there are resources available, but the direction is missing. So, Gaurav, your point of view on this specific question, then I'll come to you on this pandemic issue we are going through at this point in time.
So I think Rashie mentioned a very interesting point that yes, the combination is very important in healthcare because healthcare is very complex. So I mean, you need doctors, you need specialists. Along with that, you need technologists and engineers. Then I would also add statisticians here because you need those as well when you look at AI. So you need a lot of statistical analysis to come in, and also one of the most important pieces data set. So you need a big data set, which essentially right now, at least in India as a country, we don't have as much data as we need. Plus, along with that, even if the data is available, it is not annotated. So we would need an annotated data set. So that this the so a lot of companies and startups are right now working towards creating those data sets. Essentially, I mean, we are one of those companies because we are doing a lot of work in electronic medical record space, and the data which comes in is essentially annotated and labeled, right, properly annotated, and this can be analyzed going forward to create relevant algorithms which probably will help a lot of people in the healthcare ecosystem. One another point with respect to data is that companies also need to speak to each other with respect to data. So if there is interoperability and if data sets speak to each other, that would also be very, very helpful in healthcare, especially because if you go to one lab and you get tested and the data just resides in that lab, would as a patient, it would not be as helpful to you unless you have the data to your entire ecosystem with respect to healthcare. So whoever specialist you visit, whichever lab you go to, whether it's a radiology or pathology, if the data communicates and if it is together at one place, it would be of much more value in the longer run.
Absolutely. So that's where we talk about the interoperability and organization speaking and bridging the gap in terms of data information. Gaurav, just walk me through a classical use case if I wanted to use your app. Maybe from a layman's point of view, this is not for just a marketing point of view. If this could really be helpful from a healthcare perspective, so what is the classical use case of your app?
I would, you know, talk about the current times, right? So right now we are going through a very different time with respect to the COVID-19, and a lot of patients and doctors are, uh, uh, I mean, one, it is uh, not recommended to go and physically meet your doctor as a patient. Second, even if you do that, there are other risks that come into the picture because you are going to a hospital or a clinic where there might be other patients as well. So
True.
so here right now we have a product, in the telemedicine space, which speaks to our EMR product, and it is an integrated product in a way so that a patient, when they want to speak to their doctor, can just log in, if they have an Android or an iOS phone, can just download an app called Navya Health Manager and log in using their unique user ID and password, which is so that their data is protected and they are the owner of the data there. And then just book an appointment with their known physician or a specialist if they want to. So we are covering, I think, about uh, 27 or 28 specializations with respect to the doctors. So they can just book an appointment and start and pay a fee if doctor has a fee, and the doctor basically calls the patient at the time of the appointment, and they can do a consultation right there. At the same time, while doing the consultation, doctor has a real-time option of creating a prescription using the voice AI product, where they could do that along with a tab-based system where they are using suggestions which are coming on the basis of the behavior of the doctor. So for the doctor to create a prescription while speaking to the patient basically is a very, very easy process with a few clicks. And now the patient receives the prescription onto their app itself. Plus, they receive a WhatsApp message as well of the prescription, where they can also place an order of their medicines and their diagnostic tests if required. So
Have you
trying to cover
personally downloaded? Sorry, yes, please. You're trying to cover the
yeah, so
entire
trying to cover
ecosystem.
yeah, yeah.
Have you downloaded Arogya Setu app?
Yes, I did.
Rashi, how about you? Have you?
No, I haven't.
Working in the healthcare field, we are not really looking at. But I have personally downloaded. I think I've seen. I mean, this there's a lot of an invention which Indian government has done it specifically from in order to curb the community effect and try to actually give certain notification if somebody is suffering from corona. But recently, with Zoom case, we have been looking at healthcare AI and China. I read this few days back. I think WHO has quoted it: healthcare AI in China. And in 2017, Chinese government has published that it's planned to be the largest and leading AI researcher and sort of create a monopoly in the market. So where do you see the effects of this kind of a statement? And do you see that Indian startups have to be a little more cautious when they're building certain products? And of course, patient data is definitely comes with a lot of an integrity issue. I will come back on that. But what do you understand and comprehend by the statement healthcare, AI, and China?
Um, I don't have a very strong conclusion from that statement. I think China is one of the biggest economies in the world, and we have seen a lot of research happen in China in technology. Um, and definitely, there are a bunch of AI companies that have come out of China that have done phenomenally well in many fields, not just in healthcare. So I would see China alongside US and India leading the way to making AI more mainstream in healthcare in the coming years. I don't necessarily see anything negative there. I also feel that technology is a very equalizing concept. Like anyone, anywhere in the world can build something cool and awesome that can create a lot of impact. Governments really don't have monopoly on that. Of course, regulations matter, and having strong regulations around patient data, privacy, security is critical to ensuring that the product is created to benefit its customers, not necessarily capitalize on the data shared by its customers. And of course, I think if you talk about regulations around data privacy and security, US is perhaps much ahead of India and China when it comes to the regulations that we have seen come up in the US. But yeah, I mean, in a sense, I do not necessarily see anything wrong or right with that statement. It totally depends on the context in which that news article was written.
I saw Gaurav smiling on that when I was asking this question. Gaurav, what's your take on this healthcare, AI, and China?
No, so actually very interesting that you mentioned this, and I think I was looking at this presentation the other day, which was talking about specifically AI in medicine. So in the last 1 year or so, the prospective trials, which are like the clinical trial level trials in the AI space. So I think 80% of the prospective trials which were done for the products for AI products to be to check their efficacy, 80% of them came from China. So I think as as you said that that there was a statement that China is looking at becoming a world leader. It's very possible, and I think the country is well onto the path of it, and it's very interesting, and we probably see a lot of solutions coming in from China going forward.
Yeah, I was reading another statement as well. Software ate the world. AI going to eat the software. And then there was a Chinese who has written, we have ate a bat, but now we will eat the entire economy. So coming back to the point, of course, when I posted that I will be taking an interview or having this discussion on AI and in healthcare, a lot of people have asked me from the perspective of Bill Gates as well. I said, do not want to pick any controversial topic that you see that he's the man who is responsible for the corona spread or pandemic. I said we will not really address. Now, coming back to the point, Rashie, I am still unclear, and a lot of people usually ask me. I travel from one hospital to another, and this question is also relevant for Gaurav as well. But my data do not travel along with me.
Mhm.
I'm a person who do not really stick to one hospital in my entire journey. Like
Yeah.
we, as a family, have switched to possibly three doctors in last 4 years as a family doctor, and we usually have started going to sort of a private institution for our healthcare services. So
Mhm.
where do you see the question of data integrity and this data portability and data mobility is still a big question, and it has a lot of
Mhm.
my information enclosed in that.
Yeah. Yeah, so I mean, I think this is a legitimate problem for a lot of patients, especially in our country where a lot of prescriptions, a lot of treatment-related reports are all offered in hard copy. And in a course of treatment, you will switch hospitals, you'll switch doctors, you'll get multiple tests. Like I can speak about cancer patients. They are on a 2-year treatment journey. They'll get tens of scans, they'll get multiple treatments, and in the entirety of their disease history as well as their treatment history is literally in a folder with hard copies of all the data records. And this is a problem because if you're changing a doctor and the doctor wants to know your medical history, He or she'll have to basically skim through your physical reports, and there's a chance of things getting missed out. That is one problem that we have solved at Onco. Any patient who comes to us, we digitize their entire medical history, and they have a snapshot of their entire disease history right from the day they got diagnosed to the treatments they underwent to the consultation that was provided to even the outcomes they had, right? And this is available to them on their phone. They can carry it with them. Their doctors can see it in a view that allows them to comprehensively get a sense of their condition. And I think this is one of those use cases in healthcare where technology has played a big role in solving a very important gap that doctors face and patients face as well. Now, to your point about data privacy, I think one important thing here is that you have to ensure that if you're building a product like this, you take necessary consent from the patient on the sharing of the data, on what is the purpose of this, how will this data be stored, how will this be used, who will be the stakeholders who will review your data, and patient has to be informed. We all have a fiduciary responsibility as healthcare providers to ensure the patient is fully aware of how this data will be used. And if you can get consent, I think the guidelines that exist out there in the US, EU, as well as in India now, they're in the process of creating a set of guidelines around it. Makes it very safe and secure for patients to share it with a third party technology player, get it all digitized, and make it available to their physician, to their hospital partner, anywhere they go.
But digitization also comes with a lot of challenges because it's still centralized. Gaurav, coming back to you quickly on this, do you see blockchain can play a role here?
Uh, See, I think blockchain as a technology has a lot of promises in as it was in fintech, probably in health tech as well. But with respect to an existing success story or a use case, we are yet to see one in any of the countries that has successfully implemented it. At least I'm not aware of any successful use case where on a country level this was implemented, and then patient to doctor consent use worked on a blockchain based technology. So if blockchain or not, I think on a country level we need a system where all the other systems can communicate. So there was a national digital health guidelines that was published by the government, I think a few months back, which basically talks about a broad framework of what different players in the ecosystems are expected to do. And probably going forward there might be a database kind of a system where different digital operators can essentially plug and play and send out information and data using their APIs, like as Rashie said, they're capturing an entire patient history, right? And Navya also does a lot of patient digitization or directly recording EMRs in the form of voice EMRs. So there a lot of data comes into the system, and it should ideally go to a central database where there's a communication option where the patient gives consent, and even Navya can access data from company A, B, C, so that it comes to the doctor essentially who is treating the patient, right? So whatever technology is used to be used for it, that probably for me is not that relevant. But more relevant becomes the data should talk to each other, and it should be in some central repository with control of the data with the patient, basically.
Interesting, because there is also a big issue or a challenge of bringing each and every stakeholder in one ecosystem. Like few weeks back, there was a tragedy in my family, and we have to submit the documents from hospital to the insurance to another stakeholder, and it took about 3 weeks to do that complete process, which could happen in possibly 3 minutes. So I see that a lot of a handshaking is missing. Of course, we are working towards this common purpose of bringing cutting edge technologies and futuristic technologies to solve these problems. Rashie, I have possibly spoken at 20 plus conferences in India, specifically on various topics, and also I teach healthcare using blockchain as well. I see that gender diversity is missing. And when it comes to the new emerging technologies, we possibly, and there is a notion as well. I went to this girls' college in Punjab. They said we believe these are male dominant and male centric technologies. So we are trying to bring women leaders through Zubi as a part of a community, and we wanted to inculcate and infuse emerging technology skills. So, what is the one message you have it for the people who wanted to get into the space, specifically from the women point of view?
So I would say, I'm an engineer. I can talk about the gender diversity in my engineering school when I was there. I think we had 520 um, guys and 29 girls. So I think this is a systemic problem. It's changing, but I think a lot of young girls out there do not choose engineering and technology as a profession uh, as often as their male counterparts do. And I think part of it could be because maybe there's a lack of awareness around what career options there would be. Part of part of it could just be societal bias. I don't know, but my message would be that a career in STEM is something that if you're ambitious, you should definitely pursue. I think we are entering into a world where technology has opened doors to everyone across societies, no matter what their gender, race, religion, and it's a wonderful time, to 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 empower yourself with what's going on. And I think we need more women leaders in technology. There are, the big four tech companies in the world: Google, Microsoft, Facebook, Amazon. They have gone out there and done their bit of encouraging young high school female students to go intern with the companies to get a sense of what the atmosphere is like, work on cool projects. I think we need to do more of that in India as well. The ecosystem that we have in tech, we need to give back. We need to, and I also feel that we need more. We need mentorship will play a big role here. I think young girls need powerful mentors, and if they see that there is a career path that they can follow, that someone much older than them had done before, they'll feel more encouraged. So my message would be for them to definitely find a mentor in technology whose career path they can follow, and just really open doors. Be curious. Just encourage yourself to figure out what's going on, despite the societal bias that exists. And I'm sure they'll dominate. I think we'll see this gap closing in years to come. I'm very confident about that.
Absolutely. So definitely, I think industry should open doors for people who wanted to pursue the careers, specifically in the domains and need some direction, and mentorship can be provided. Gaurav, India is a country where we are placement, power, and position centric, not purpose centric. How and where do you see we can increase the adoption of artificial intelligence among students? A lot of people still are unclear about the different terms which are there under the umbrella of artificial intelligence. It goes from deep learning, machine learning. All these could be the metaphors, but when it comes to the practical understanding, they still lack at it.
I think,
So,
Aman,
what's your
it's a
message for
very,
them?
very interesting point that you have mentioned. So it's a very loosely used term, to be honest now, and it has to be. I mean, people should understand it well before using it. That's important. But at the same time, if you look at the global phenomena with respect to the companies that come in the AI space, lot of the companies who are doing really well now were student startups basically. So this, because being a very new field, students find it very interesting and they try out. I mean, I've seen companies out of US, Canada. A lot of them were student startups, and now now they're really big companies in this space. So students who are interested or are keen in looking at AI, probably, this is the probably the best time, because the ecosystem is very hot. There are so many, as Rashi mentioned, mentors out there who can help them, and also there are so many problems which can be solved. So you can look at from the problem perspective or a purpose perspective. So once you start looking at the problems and try and look find solutions to them, you will probably then go back to your drawing board and then think, okay, if there's a solution around it, then probably you can build something. You can start building algorithms around it. You can start building first on a very basic level, start building a framework around it, and then probably start building an algorithm around it and build a company out of it. So so if you probably now the students this is the best time for them to look at it from a problem solving perspective. They should go out and look at as many problems as they see. uh, those are all the kind of companies that can be built basically going forward. And now the program I mean the servers have become much less expensive than they were earlier. So the computational cost is so low that you can actually go out and build good sophisticated programs at very low cost.
Interesting. So if I'm using your Siri app or doctor is using, where is the artificial intelligence in that? Where is machine learning? Where is deep learning? If I
Yeah.
say, hi, Mr. Gupta, thank you so much for coming to my clinic. You have been diagnosed with a fever. I am giving you a prescription. So where is artificial intelligence, machine learning, and deep learning?
Sure. Very, again, you have to break it into different parts. I mean, I will probably not deep dive much into it, being some bit of it being confidential information. So I'll just quickly give you an overview of how the system works. Uh, so we use existing APIs from people who have solved the voice to text problem. We are not solving the voice to text problem, which has already been solved in the industry. So once a certain set of information is converted into text, that is where our engine starts working, and it starts looking at the text and tries to contextually understand the text. So the difference between a pharmacist and me is essentially a pharmacist knows the context of if a prescription is written in a format in a way that complaints and then diagnoses and then medicines with a regimen. So pharmacists would understand contextually that these complaints probably lead to this certain set of diagnoses, and these diagnoses probably will lead to this certain set of medications. So that is why they are authorized to you know dispense medicines. So if there is a mistake or if there's a lack of understanding in the prescription, pharmacists would understand that contextually, right? So this is what we are building in our system: a contextual understanding of the prescription. So that it is sort of replicating the pharmacist's brain into the system, and it can contextually understand what the prescription essentially is, and then relevant and put the relevant data into the relevant buckets, so that the final output comes out in a way where doctor can easily understand it, comprehend it, and look at a bigger set of data of complete patient history in a single overview, essentially.
All right. So there is also a question on the medicine counterfeit as well. I definitely don't want to delve into that because that's also an area which can be addressable by distributed ledger technology. Rashie, a few days back, I was reading about virtual oncology. Is it essentially talking about the tele medicine kind of a concept which is there, or is something which is different? And my last question would be to Gaurav, maybe you can think about it, would be I wanted to understand how genome data is helping healthcare, or there was something which I was reading about it. I'll rephrase the question. So Rashie, over to you.
Sure. So I think I'm not sure in which context you came across the terminology, but we use this terminology in two contexts at Onco. One is around teleconsultation, where we would connect a doctor with a patient and help them get a teleconsultation. The doctor will have a digital clinical summary of the patient available to them, and then the opinion of the doctor will also be provided to the patient in a digital format that they can consume, that they can take to their local doctor when they have a physical consultation. The other concept, sort of the other domain where we use this terminology is for a service that we call virtual tumor board. So in cancer, typically, in the West, if you look at how oncology is practiced, typically a multidisciplinary team of oncologists will come together review your entire diagnosis, your entire history, and then come up with a collaborative opinion. And this team is actually called a tumor board. At Onco, what we've done is we've created technology to enable a virtual tumor board opinion. What that means is that we'll identify 2 to 3 specialists who specialize in the patient's cancer, and then we'll get them together virtually, and they'll use our platform to collaboratively provide an opinion, which is going to be more exhaustive because we'll be able to cover all aspects, all disciplines. So we'll form a panel of a surgical oncologist, a medical oncologist, and a radiation oncologist. We'll provide digital summary of the patient's condition to the doctors. And then we have built technology, we have templatized this entire process of providing an opinion for a panel of doctors that allows them to provide an opinion virtually in the form of a report, which is more exhaustive, in many times more exhaustive than the physical consultation that the patient receives. I think Aman dropped out.
Yes.
I guess we'll wait for him to join back.
Sure. I think Aman is just about to join.
Yeah.
Can you hear me? Can you hear me? Can you see me, Rashie and Gaurav?
Yes,
Yeah.
Aman. I think we can't hear you now.
अरे ऐड करे और right now, right. Just yeah. Yes, can you hear me?
Yes.
Yes, Aman.
All right, but I can't hear you. That's the problem. All right, so apologies, I don't know what has happened. So I'll ask my colleague Karthik to ask questions. I think we were on the conclusion. I heard you, Rashie, till the last point, and Gaurav, maybe you can just throw some light on genome and healthcare, and then we will straight away move down to the questions.
Sure. So, I think I'm audible, right, Rashie? Can you hear me now?
Yeah. Yeah, got it.
Yeah. Okay. So, so basically, it's a very, very interesting question because a lot the application of healthcare AI essentially would probably be the most important in genomics and proteomics as far as I can see it. So because most of the drug discovery and you know uh, pharmaceutical research also is going into that direction. So we have to look at it from the perspective uh, of personalized medication as well. So if we are going into that genomics, proteomics, and personalized medication use of the data set, with we can with the help of AI, we can basically, instead of targeting millions of patients, we can target specific set of patients and look at their gene structures and develop medicines and drugs specifically for a smaller set of population where it is the efficacy is higher. So instead of making a drug which is with an efficacy of 40% for 100% of population, we make a drug which is probably have a 80% efficacy for a smaller set of population and make 5 such drugs. So there the application of AI would probably play a very, very important role going forward. And some of the labs in Europe and US are doing really, really interesting work there. And I think in India also we have good potential of doing that because we have really smart people, and the data which we want for this is also available, which can be sourced by such labs in such wet labs, as you say, from Europe and US. And in India we can do a lot of algorithmic research on that data and come out with good inferences.
Okay, so we have questions posted on the chat. You can look at it. Uh, we have questions.
Hey, Aman, so I
All right,
have
so
a
we
hard
have
stop
questions
in a couple
posted.
of minutes. So
Okay,
if there's
okay.
a
My
specific question
apologies. Yes.
I can answer, yeah,
All right.
no
So
problem.
okay. So there are questions. I will ask one question to you, and then Gaurav can answer one, and some of the unanswered question we will send out to you. So one person is asking from an oncology background. Hi all, I'm from an oncology background. Also in terms of cancer specifically, there is a personalized diagnosis with the help of FMI in India, and not really sure what's the question. There is a question by Karthik Gabra. How important do you think the security of healthcare IoT devices will move on to become? Like, for example, if a pulse setter is hacked, it can compromise on the life of a patient. So, Rashie, you can quickly answer this question, and then one question Gaurav can answer, then we will wrap up our webinar.
Yeah, I don't think I have a deep understanding of how security of IoT devices work, but my high level understanding is that you can create stronger protocols around data storage. So even if an IoT device is using just any variable, it's capturing your data. The data is at the end of the day stored in a secure cloud-based server, and basically, even if your watch is hacked, I am not sure how much of that really impacts, your data. But having said that, there are some complex security-related aspects that I'm not an expert in answering. Hacking is going to remain a problem in general, and that's why there are a lot of security startups out there in the world that focus on building stronger and tighter protocols. Um, to prevent hacking. Right.
Great. Thank you so much for joining, Rashie. Since you have mentioned you have a hard stop at 8, we'll keep the time in mind. Apologies for the glitch which has happened. Gaurav,
No
hope
problem.
you can stay for next couple of minutes, and we will ask some questions and we will conclude. Thank you so much,
Thanks,
Rashie. We shall
guys.
stay in
Thanks,
touch.
guys. Nice
Wonderful
talking to
message
you.
for the people.
Thank you. Thanks. Bye.
Gaurav, there is a question from Mr. Dilip. Hi, can you let us know what are the recent advancements of AI and machine learning in healthcare, and which specific area it is used? I think the focus discussion was primarily about AI and machine learning, and a lot of different verticals and use cases in healthcare. But still, if Gaurav wants to highlight some of the use cases, that'll be wonderful, apart
Sure.
from what you are working on.
Yeah, sure. So a couple of very interesting use cases. If you are interested in this industry, you must have probably seen one of the most famous one is the Google's project, which is the diabetic retinopathy, right? So where what Google essentially did was took a lot of retina scans, have a huge data set of retina scans, and trained the machine around the the patients who have diabetic retinopathy or who haven't. So it has become and the machine eventually, when the machine was trained, with millions of data points, it became about more than 90% accurate, and now it is FDA approved, and you can have a test in a supermarket if you want in the US, and essentially it's so simple that it'll right there. People who would probably never have gone for a diabetic retinopathy scan are going and getting a result in a matter of minutes, and then they can, it is basically acting as a screening test, and then they can go for a further, if they get a positive, then they can go for a further more human centric screening, where they can be sure of probably a result where they're 99.9% sure whether they have it or not. So this use case essentially um, has made this test much cheaper and much more convenient and faster for both the patients and the providers.
Interesting. One last question before we wrap up is Gaurav, how and where do you think collectively, with the help of students, we can create or develop a solution which can address to this present issue or a challenge of corona or this pandemic around the world, and specifically looking at India as a country?
Again, very interesting with respect to COVID. So we have seen a couple of use cases. Like in Canada, there was a company which very early on predicted and alerted people about a certain set of people about COVID, and I think so, which leads to a point where prediction can happen. So if data is properly tracked and traced, a lot of predictive analytics can be run, and predictions around using AI algorithms can also be done focused on COVID, essentially with respect to different areas, because it spreads from one area to another area, and we can be better prepared with respect to where what actions and what steps need to be taken. So that is one very important area where uh, I think a lot of people have started working on as well and should work on. Parallelly, we can also look at cases where it is non-COVID patients. If you're looking at healthcare specifically, so non-COVID patients are also in a need of treatment, because our healthcare infrastructure is sort of overloaded right now. So you can also look at spaces where you think someone in your family is facing a certain set of problems, and if you can look at that problem and analyze and understand how do you solve, mm, for a patient who is a non-COVID patient, with the pressure on healthcare ecosystem. There could be use cases around that, like one of which we are seeing as telemedicine. Another could be, as someone asked, about IoT. So IoT, with respect to home healthcare, so devices which would tell you, sitting here, my doctor can, you know, basically, it is like a remote stethoscope, so they can hear my my heartbeat and other things. So one of the very interesting use case was with in this space, was with respect to the remote ECG. So a company which has developed the remote ECG using AI technology. So it is a very small device which is connected to your mobile, and you can just, the AI assistant will basically assist you on how to use it, and you keep on using it on the basis of the assistant, and then the whole ECG is recorded and also transferred to your caregiver or your doctor or provider. So that helps. So the remote consultation and remote diagnostics can also be of use here.
Fantastic. I think we are living in a very unique time, and how we can use entire healthcare system virtually. And I think with the advancement of technologies and enabling of technologies, healthcare systems are being are actually revolutionizing the prevention, diagnosis, and treatment. And diagnosis definitely stay at the tip of iceberg. Thank you so much, Gaurav, for taking out time. Definitely, it has been a very insightful session. I'm very sure the participants would learn a lot from both of you and what you are doing. All the best, and we look forward for certain kind of a collaboration which can happen from Zubi's point of view, wherein students can get more equipped and enabled towards building more meaningful projects, specifically looking at the healthcare industry. Thank you so much. Thank you so
Thank
much,
you.
viewers, for signing in today. And let's stay in touch. You can follow us on Zubi and different forums which are being highlighted. Yes, Gaurav, the last message from you.
Thank you, Aman. It was a pleasure, and I hope the students uh, who we are living in a very interesting time, as Aman said. So look at it from the problem perspective. Try go out and solve those problems using your best intellect.
Thank you so much, Gaurav. Thank you.
Thank you, Bob.